Welcome to our comprehensive guide on the powerful benefits and potential side effects of Kayexalate. This medication has garnered attention for its effectiveness in treating a wide range of conditions. In this video, we will delve into how Kayexalate works and explore its diverse uses. Understanding the benefits of Kayexalate. Kayexalate, also known by its generic name, sodium polystyrene sulfonate, is primarily used to treat hyperkalemia, a condition characterized by high levels of potassium in the blood. When potassium levels become too high, it can lead to serious health complications, including irregular heart rhythms and muscle weakness. Kayexalate works by binding to excess potassium in the intestines, allowing it to be eliminated through the stool. The benefits of Kayexalate, however, extend beyond hyperkalemia. Over the years, studies have shown that this medication may have additional therapeutic uses. For example, Kayexalate has shown promise in managing heart failure by reducing potassium levels and improving heart function. Additionally, it has been used in the treatment of certain medication overdoses, where high potassium levels pose a risk to the patient's health. While Kayexalate can be a valuable tool in managing these conditions, it is essential to understand the potential side effects that come with its use. Exploring the potential side effects of Kayexalate. As with any medication, Kayexalate carries the risk of side effects. While not everyone will experience these side effects, it is important to be aware of them before starting treatment. Common side effects of Kayexalate include gastrointestinal discomfort, such as nausea, vomiting, and constipation. These symptoms typically resolve on their own, but if they persist or worsen, it is advisable to consult a healthcare professional. In rare cases, Kayexalate can cause more serious side effects. One such side effect is intestinal necrosis, a condition characterized by damage to the intestines. This risk is higher in patients with a history of gastrointestinal disorders or those taking other medications that affect bowel function. It is crucial to discuss any pre-existing conditions or medications with your healthcare provider before starting Kayexalate. Another potential side effect of Kayexalate is electrolyte imbalances. While the medication primarily targets potassium, it can also affect other electrolytes, such as sodium and magnesium. Regular monitoring of electrolyte levels is necessary to ensure they remain within a healthy range. How does Kayexalate work? To fully understand how Kayexalate works, it is important to grasp the basics of potassium regulation in the body. Potassium is an essential electrolyte involved in various bodily functions, including nerve and muscle activity. However, too much potassium can disrupt these functions and lead to serious health complications. Kayexalate works by exchanging sodium ions for potassium ions in the intestines. The medication contains sodium polystyrene sulfonate, a resin that binds to excess potassium, forming a complex that is then eliminated through the stool. This process helps reduce the overall potassium levels in the blood, restoring the balance and preventing potential complications. The effectiveness of Kayexalate varies from person to person and depends on factors such as the severity of hyperkalemia and individual response to the medication. It is essential to follow the prescribed dosage and monitor potassium levels regularly to ensure optimal results. Range of uses for Kayexalate. While Kayexalate is primarily prescribed for hyperkalemia, it has shown potential benefits in other medical conditions as well. One such condition is heart failure, a chronic condition characterized by the heart's inability to pump blood effectively. In heart failure patients, high potassium levels can further compromise heart function. Kayexalate can help lower potassium levels, alleviating stress on the heart and improving overall cardiac function. Another condition where Kayexalate may be utilized is chronic kidney disease. In advanced stages of kidney disease, the kidneys struggle to eliminate excess potassium from the body, leading to hyperkalemia. By assisting in the removal of potassium through the intestines, Kayexalate helps manage potassium levels in these patients. Additionally, Kayexalate has been used in certain medication overdoses where potassium levels can become dangerously high. By facilitating the elimination of excess potassium, Kayexalate can help prevent potentially life-threatening complications. Kayexalate dosage and administration. The dosage of Kayexalate may vary depending on the individual's condition and potassium levels. It is essential to follow the prescribed dosage instructions provided by the healthcare professional. Typically, Kayexalate is administered orally, mixed with water or sorbitol to improve palatability and aid in its elimination through the stool. The timing of Kayexalate administration is crucial to ensure optimal effectiveness. It is generally recommended to take Kayexalate on an empty stomach, at least 1 hour before or 3 hours after meals. This helps prevent interference with the absorption of other medications or nutrients. Precautions and considerations when using Kayexalate. Before starting Kayexalate, it is important to inform your healthcare provider about any pre-existing medical conditions or medications you are currently taking. Certain conditions, such as gastrointestinal disorders or kidney disease, may require close monitoring or adjustments to the dosage of Kayexalate. Additionally, some medications can interact with Kayexalate, potentially reducing its effectiveness or increasing the risk of side effects. Pregnant or breastfeeding individuals should consult their healthcare provider before using Kayexalate, as its safety during pregnancy or lactation has not been extensively studied. Alternative treatments to Kayexalate. While Kayexalate can be an effective treatment for hyperkalemia and other conditions, there are alternative options available. One such alternative is dialysis, a procedure that helps remove excess potassium directly from the bloodstream. Dialysis is commonly used in severe cases of hyperkalemia or when other treatments have not been successful. Another alternative treatment for hyperkalemia is the use of potassium-binding resins other than Kayexalate. These medications work in a similar manner by binding to excess potassium in the intestines but may have different side effect profiles. Your healthcare provider will determine the most appropriate treatment option based on your specific needs and medical history. Frequently asked questions about Kayexalate. Can Kayexalate be taken with food? It is generally recommended to take Kayexalate on an empty stomach, at least 1 hour before or 3 hours after meals. This helps ensure optimal absorption and effectiveness of the medication. How long does it take for Kayexalate to lower potassium levels? The time it takes for Kayexalate to lower potassium levels varies from person to person. It depends on factors such as the severity of hyperkalemia and individual response to the medication. Regular monitoring of potassium levels is necessary to determine the effectiveness of Kayexalate and adjust the dosage if needed. Are there any dietary restrictions while taking Kayexalate? While taking Kayexalate, it is generally recommended to avoid potassium-rich foods, such as bananas, oranges, and tomatoes. Your healthcare provider can provide specific dietary guidelines based on your individual needs. Are there any long-term side effects of Kayexalate? Long-term use of Kayexalate can potentially lead to electrolyte imbalances, such as low sodium or magnesium levels. Regular monitoring of electrolyte levels and ongoing communication with your healthcare provider can help manage these risks. Conclusion: is Kayexalate the right medication for you? Kayexalate, with its ability to lower potassium levels and treat hyperkalemia, has proven to be a valuable medication. It has shown promise in managing heart failure, kidney disease, and certain medication overdoses. However, like any medication, it is important to be aware of the potential side effects and consider alternative treatment options if necessary. If you have been prescribed Kayexalate or are considering it as a treatment option, it is crucial to consult with your healthcare provider. They will evaluate your individual medical history and determine whether Kayexalate is the right medication for you. Remember, this video is not a substitute for professional medical advice. Always consult with a healthcare professional before starting or changing any medication regimen. Thanks for watching.